Mr. Chairman, and Newtown and other events have highlighted the importance of this issue, and I very much appreciate your holding this hearing. Let me start off. I'm going to approach the issue in a little bit different way, Mr. Chairman, than some of our colleagues. The United States of America is the only country in the industrialized world that does not have a national health care system. In my view, in the midst of major health care crises in this country, including 50 million people today without any health insurance, hopefully that number will be significantly reduced under the ACA, the reality is that when you don't have a system, you're not prioritizing. So what that means, not only are we not paying adequate attention to mental health in general, but the disparities based on income and where you live are also enormous. Senator Murkowski mentioned the problems in rural Alaska, Native Americans. What I can tell you, and I want you to deal with this for a moment, if I'm making $500,000 a year and I'm living in New York City and my kid has problems, the likelihood is I'm going to be able to get reasonably good mental health treatment for that kid. That's the likelihood for my kid. On the other hand, if I live in rural Vermont and I'm making $25,000 a year, you know what? I'm going to have a very difficult time accessing the mental health care that my kids need. That's true, I suspect, in Tennessee, and I suspect that it's true all over America. The reality is, right now, that we have a primary health care system which is a disaster, that whether it is physical illness or you made the point that we do well with mental health when people can access the system when they need it. In my office, I can tell you we get calls in Vermont where family members say, I have my kid, my husband, serious problems. I can't find mental health treatment now. So let me ask you a simple question. If our goal is to make sure that mental health care is available to all people who need it, how many thousands and thousands of mental health practitioners does this country need, and how do we get them? Dr. Insel, why don't we start with you?
So I'm going to turn to my colleague who's just completing a workforce assessment, and so she's actually looked very carefully at this issue.
Beside, how many thousands of mental health practitioners do we need?
We don't have good studies that say how many we need. We have lots of data that tell us what we don't have. And we have lots of data that give us comparisons between certain areas and certain types of practitioners. We are just completing a report for Congress on that. It'll be ready soon.
Well, before we even get to the report, and we need good data, tell me, is it fair to say that if I am a low-income person living in rural America or urban America, today I am going to have a very difficult time finding mental health care for my loved one?
Senator, I was actually going to go right there, so thank you for the question, which is, it's not even so much, although clearly in certain areas of practitioners we don't have enough, but it's also the distribution. The distribution is, I come from New Mexico, so we have major rural areas in New Mexico, and there are counties in New Mexico that don't have any behavioral health practitioners, none, zero. We have something like 75% of the psychiatrists are in what we call the Rio Grande corridor.
Which let me guess, is probably, not knowing anything about,
Albuquerque and Santa Fe, yes.
A wealthier area.
Well, it's more urban, certainly, right. Yes, and where the universities are.
All right, we don't have a whole lot of time, so my question is, if I am a working class person, if I am unemployed in this country, is it a fair statement to say, especially if I'm living in rural America, that it will be very, very hard for me to access affordable mental health care in a timely manner? Is that a fair statement?
I think it is fair to say that rural areas have a more difficult time. There are clearly programs like community mental health centers, like community health centers that have been explicitly
Well, I worked very hard. Let me just interrupt. I'm sorry. I apologize. We don't have a lot of time. I worked very hard to double the funding of community health centers and triple the funding for the National Health Service Corps. I think we made progress. Would you agree that we need a long, long way to go? to expand even beyond where we have gone in recent years.
I would agree that we need more practitioners, absolutely.
And I would add to that it's not only across the board, but there are particular areas of need that need attention. One of them is in children. So we've been talking a lot about youth needs. Child psychiatry is way underemployed.
Absolutely.
And child psychology is incredibly important to build the workforce.
All right, let me just conclude. I think it's a class issue too, Mr. Chairman. I think to some degree psychiatry is something that is accessible for urban, upper-income folks. It is not accessible for low-income, rural folks. So I think the point that Ms. Hyde made is an important one. We have to look at geography, and we have to make sure that mental health is available to all people, regardless of their income, all over this country. Thank you, Mr. Chairman.
Thanks, Senator. I might just add that since I focus so much on prevention and early intervention right now, school psychologists, the national average is 1,500 to 1. The recommended ratio, I don't know recommended by whom, is 700 to 800 students per psychologist. So we need to double that if we're even going to meet a recommended level of for kids in school. Senator Whitehouse, Senator Warren, welcome to the committee.
Thank you very much. Thank you very much, Mr. Chairman. Thank you. It's good to be here. And I also want to apologize for coming in late. I have the best possible excuse. I was introducing my senior senator, Senator Kerry, to the Senate Foreign Relations Committee. And I believe that will not be a recurring event. So,
Is that your way of saying soon you will be the senior senator from Massachusetts?
yes, sir, it is. So I thank you. I would like to start with my questions in the same place that Senator Enzi started. I have a very similar interest in the questions about research, around evidence-based medicine, around accountability, around our funding for research. So what I'd like to do is just start with you, Dr. Insel, if you would, and ask you to do two things for us. The first is just paint us a little bit of a picture about what we can do with research in the mental health field. If we get some good research, what can we learn that we don't know? And to talk just a little bit about what funding levels are doing to research.
Well, thank you for that question. I don't usually get an opportunity to talk about this, and I promise I'll do it very quickly. But you're asking the question at a critical moment in time. We are really, in the case of understanding mental illness, where we were in some ways for studying cancer 20 or 30 years ago. We're just on the cusp of a revolution, and it's because we have these extraordinary tools now. And for the first time, we can approach problems of the mind through studying the brain. And that gives us a kind of precision that we've never even imagined we could have. The reason that's so important is because for behavioral problems, whether they're in Parkinson's disease or Alzheimer's disease or Huntington's disease, the behavioral symptoms are a very late event. Those are the heart attacks. And it's the same thing, we believe, for the psychosis in schizophrenia. We define these as behavioral disorders, but in fact, they're brain disorders. And the brain changes are probably occurring years earlier. And if we want to detect and intervene earlier, we're going to have to be able to develop ways to get at that, to understand them as brain disorders in the same way that we've done now in many other areas of medicine. So I think where the science is taking us is towards the biomarkers, it's towards the fundamental biology. We have not been there before. We've had a very simplistic approach to this. It is far more complicated. The good news is we've got far better tools to be able to unpack this. Your question was about the funding. It's a challenge. There are lots of questions, lots of things we'd like to answer. I'd have to say that for NIMH, the shift has largely been to move much of our funding to people who actually 10 years ago were studying cancer and heart disease, who are now joining us because they feel that autism and schizophrenia are the new frontiers. And these are the places where you're going to make the big breakthroughs. It's always frustrating because there's, of course, never enough funding to support all of the best ideas that come in. We try to support about 20% of them, so about 1 in 5 grants gets funded. I hope that I'm smart enough to pick the best 20%. I'm afraid I'm not, and I think if I could do 30%, I'd probably have a much better hit rate. It's just hard to know often. So that's always the challenge, is you never have the funding you want to do all of the science, some of which is just spectacular, that's sitting there in front of you.
Can I ask you just to expand on that in one more dimension? And that is, if you describe it as your hit rate, if you really hit on some of these studies, on Alzheimer's, on autism, can you just speak briefly about what the financial impact will be on the country?
Well, so we know that in the case of Alzheimer's, that if we can just forestall the dementia by a matter of a year or 2 years, which is certainly, I think, within our grasp as we've gotten a better understanding of how to predict and now looking at ways to intervene, we're talking about billions of dollars that will not have to be spent, which are now going into the care of people with dementia. It really comes down to a question of, do you want to invest early or do you want to pay later? Because you don't know enough and you're not doing this in a way that's efficient. And unfortunately, I think we've tended to decide that we'll pay later, often at a very large premium, instead of making the early investments in Alzheimer's, autism, schizophrenia, to make sure that we come up with better solutions.
Thank you very much. Ms. Hyde, my time has expired, but if you had a quick comment you'd like to add, I'd be grateful.
The quick comment here is you know, of course, that these disorders have profound impacts on our justice systems, on our school systems, on our public welfare systems, our child welfare systems. There's profound dollars that are being spent there because we are not intervening early, because we are not providing the kind of supports to the young people and their families.
Thank you very much. Thank you, Mr. Chairman.
Mr. Chairman, thank you. I was unfortunately on the floor with my senior senator. There's nothing unfortunate about that, on an issue of great importance to Colorado, so I missed the testimony. I think I'll refrain from asking my questions today, and I'll submit some for the record if that's okay with you. And I know there's a second panel, but I want to thank you very much for holding this hearing, and I'd like to join Senator Frank in saying how delighted I am to see our ranking member